Thank you for tuning in to the Skin Therapy Show. I'm your host, Sarah Teshna, and I'm still here with Hope Wanyika, who is a hair technician, and Mr. Stephen Omolo, who is a hair trichologist. Who do you recommend for such procedures?
Anybody can do hair transplant procedure, but we usually recommend like from the age of at least 20 onwards, around 50, 60. We don't want to do it above 60, 70 years because of what it involves, the timing. You have to lie down for quite a number of time. Yeah.
Such a long time.
Yeah, but it has been done, even for 70-year-olds, it has been done.
Okay. So Steve, does it mean that you treat this new hair differently from the already existing hair?
Actually, there's something we call donor dominance, yeah, which is the hair that we transplant carry with it the same characteristics it had on the donor area. Yeah. So when we bring it on the hairline, it's much stronger and more resistant to those stressful hair maintenance techniques. Yeah. But we still advise our clients to be more gentle because traction is traction, braiding is braiding. If you continue braiding, you might still lose the same hairs. So in fact, we advise our clients, if possible, just go natural. Stop those other, do a wig if you have to.
Yes.
Other time, just try and maintain your hair natural.
Maintain your hair natural. When you say donor dominance, especially like for adults who want to, have more hair on their head, where specifically does the other hair come from?
The best donor area is on the occipital region, just basically at the back of your head, coming towards the temporal regions, but not after the ears. You cannot come above the ears, and then also the crown. You cannot touch the crown because when you're losing hair, there's a pattern it takes. Yes. Yeah, there's a pattern, like when it is genetic hair loss, there's a pattern it takes. So it should not go above the occipital protuberance. There's usually a bone at the back of your head. You should never go beyond that.
I'm sure you have seen on the streets, as you're working on the streets, people are selling products that they claim that they can actually rejuvenate the hair. Are these products working, or is it just a marketing process?
Well, this is a great concern because the market is flooded with such like products. Yes. What all of us should be able to understand is we need to have an understanding of how hair grows. Hair is dead from the outside, but it is alive from inside. This means beneath the scalp level. Now, hair grows from cells. In a place called germinal matrix area. So as these cells grow and they keep on coming out of the hair follicle, that's why we are saying the hair is dead from the outside, but it is alive in the inside. So whenever we apply products on the scalp level, it's not a guarantee that they're going to be absorbed and assist in the hair growth. So one of the best remedies of hair loss is nutrition. If you are getting a good nutrition, then definitely your hair is going to grow well. However, we're not ruling out the fact that some products can help in hair growth. Something like olive oil and other that are being researched on. The skin has the capability of absorbing this, and they help in rejuvenating the cells just beneath the skin surface. So it is not all of them that cannot work, but some natural products are able to work. But the most area that you are sure of that can work is about your nutrition.
All right.
And then you find that in most in the society nowadays, most women are maybe opting for quick fixes. For example, if I'm having hair loss, I'll go and get myself a weave. If my hair is thinning, I'll go and get braids. But this is worsening the situation.
And you get the bangs.
You get, you're right. So this is worsening the situation. And like my friend has said here, I think the best thing is see a trichologist or a specialist who will be able to advise you on what exactly you're supposed to do, and don't just opt to do a quick fix which might aggravate the problem even more.
Okay. Is it true that women who are breastfeeding lose hair?
Yes, you're right. Women tend to lose hair just after childbirth, but many people associate it with breastfeeding, but that's not the case. What you need to understand is that hair grows in stages, and we have 3 different stages. We call them anagen, telogen, and catagen. At one point, which is the anagen stage, the hair is really growing, actively growing, and women tend to have a lot of hair that particular time. Then after that period, there's a transition period for relatively 2 weeks where the hair is resting, the hair follicle is resting, and then thereafter catagen, where nothing is happening at all. So when somebody is pregnant, due to hormones and all that, the hair really tends to really grow. So that is the anagen stage. So the hair is held up in the anagen stage for quite some time. So it doesn't go the right way, the cycle that it used to go before. So now when it comes to after the childbirth, after when now the mother starts breastfeeding, so the hair rapidly, many of the hair follicles, which were in anagen stage, now rapidly go to the catagen stage, where now there is rapid hair loss. So you find that women tend to lose a lot of hair at that particular time. So it has got nothing to do with
nothing to do with breastfeeding.
Nothing to do with breastfeeding.
Contrary to
because
what people think.
yeah, that's what many people think. But it's the cycle that was interrupted, and that's the reason why it's happening at that particular point.
Okay. Steve, when should one seek professional help when it comes to hair loss?
Actually, when you're losing hair for more than 6 months, then you need to seek help to determine why you're losing hair. Because the cause usually might have happened like 6 months earlier. So there's hair loss that is self-correcting. So if it is not correcting itself after 6 months, then it might look like something permanent. That's why you need to seek help to determine what's causing it. Probably it can be corrected through other means. Probably it can still be self-correcting. So it is very, very important that when losing hair, seek help from a professional.
Right. Steve, your final thoughts on today's topic and the home remedies that you recommend for hair loss?
I think I will recommend extra virgin olive oil. It is a good oil for the scalp, and it can actually help hair become stronger. The other one I will recommend is coconut oil. It's a good moisturizer because it is actually able to penetrate the cuticles and moisturize the hair well. The third one, probably you can use things like egg yolk for protein treatment if you don't like the other stuff.
You see me cringing right now because I'm imagining putting egg yolk on my head.
I know it's not looking that good, but I mean, it's a good one. It's healthy, it's natural, and not everybody that comes to clinic will require a hair transplant. If you've not lost all the hairs, they are just thinning out. You can try and regrow those hairs using other therapies. We have gels, we have PRP, we have lasers that you can also use to regrow such hair. So I want to just tell guys out there, seek help from a professional. Get to know what's causing your hair loss before you start using anything.
Where can people find you, Steve, and your contacts, your location?
You can find me on Bishop Road, a building called Fort Granite Flats, Suite 1, called Mel Health Solutions. You can find me there. You can go to my Facebook, Steven Omolo, I have a web page, or you can go to my website, hairlosskenya.co.ke, and you'll still find me there. Or you could still call me or WhatsApp me on 0721 320 151. Yes.
All right. And you hope?
You'll find me at Ashley's Hair and Beauty Academy. We are on Kimathi Street, Lyric House, 4th floor.
Okay.
Yes.
Thank you so much for coming. Today's episode has been very informative. We really thank you, and we hope to see you very soon as we talk more on hair transplants and hair treatment. And to you back at home, thank you so much for joining us. We hope that you were informed as much as I was. Please do not forget to keep the conversation going on our social media pages. That is Facebook, The Skin Therapy Show, Instagram and Twitter at The Skin Therapy Show. I will see you again, same time, same place next week. From us is good night.